Hi, my name is Elizabeth Palley. I am part of the ID8 Fellowship Program at Adelphi University, and I've been working with Dr. Chrisann Newransky and Dr. Adrial Lobelo, also at Adelphi University. And on this fellowship, we've been trying to understand students' experiences with interprofessional collaboration. The goal of the ID8 Fellowship is to train social work MSW students and nurse practitioners in integrated behavioral healthcare settings to work with children, adolescents, and transition-aged youth. The idea is to increase access to high-quality integrated behavioral health services in underserved communities. So what I did was a focus groups following the fellowship, and the fellowship involves a core curriculum, which is separate for nurse practitioner students and social work students, professional development seminars that they take together, and clinical placements and practicums, which are in integrated behavioral health settings to the best of our ability. So what we wanted to know was how the students experienced their training in interprofessional education. And what we did at the end of the year of the students' time in the program, we did focus groups. So with each, there were 2 to 10 students per group, and there were 2 to 4 focus groups per year, depending on the year and student engagement. We had an open-ended questionnaire that was designed to find out about their overall experience, as well as how the fellowship and the coursework train them in integrated behavioral health and to work in interprofessional settings. This is just an overview of the students who participated. You can see we had between 29 and 51% participation. These are the demographics of our students in general. We did not collect the demographics of the students who participated in the focus groups. So as with any focus group, we recorded and transcribed the transcripts. We had students correct them for errors using the Zoom transcripts. We had 2 people, a PhD student and a faculty member, review and manually code all the transcripts, different students at different times and different faculty members, but we were able to come up with some initial codes and compare. We created emerging themes, and given the number of people who participated, we were able to compare the data with the code definitions and check for agreement. So there was coding reliability, and we resolved disputes through discussion until we reached consensus. The results, the overall results were that students responded that they had professional growth and skill development. They developed cultural competence and diversity awareness. They learned interprofessional and collaborative skills and integrated care, and they were experienced overall satisfaction with the fellowship. This presentation focuses on the interprofessional collaboration in integrated care. The codes for interprofessional collaboration was the experience with other disciplines was helpful, learned the value of integrated care, increased confidence and skills, brought everything into focus. Simulations provided opportunities for collaboration, more simulations to practice skills, a desire for more collaborative opportunities. I think that's the same one. Helpful to know each other's professional role, and in social work that the courses were consistent, in nurse practitioner program that they weren't necessarily consistent. Overall, students valued exposure to healthcare models. They increased ability to work alongside other professionals. They had greater respect and understanding, and they wanted more time and more simulations, basically. These are just some of the results. In response to student feedback, we have made changes throughout the fellowship. We added an additional simulation after the 2nd year. We added additional time to the simulation, and we worked with the field office to increase the number of opportunities for students to be in interdisciplinary settings. That's it.